Welcome back to the second part of the eye and ear conditions lecture. And in this part, we're going to focus on the ear. So just a reminder of the aims and objectives of this lecture. We're looking at common eye and ear conditions presented in community pharmacy, learning how to identify and manage conditions with over-the-counter preparations, and identify red flag warning signs and when you should refer to another healthcare professional. Reminder of the terminology. So the speciality in medicine treating eyes is ophthalmology, and in this lecture we're looking at the ears, and that speciality in the UK is known as ear, nose and throat, or ENT. So anatomy of the ear. The conditions that affect the ear can affect the outer, middle and inner ear. This diagram shows you the whole of the ear and all three parts. So take a look at that, but we'll also look at each part in more detail. So this slide shows us the outer ear, also known as the pinna, which is a word that describes the whole of the ear. So one part to take note of here is the tragus, which is the small kind of triangular piece of cartilage that sticks out over the opening to the ear canal. The middle ear here includes the eardrum, which is membrane between the outer ear canal and the middle ear. And then we've got the bones that are involved in the transmission of sound vibrations to the cochlea. So here we've got the malleus, the incus and the stapes, which are the three smallest bones in the human body. Actually, good pub quiz question there. And you can see the eustachian tube there as well. Here we've got a similar diagram but focusing on the inner ear. So this has got two parts. The hearing part of the inner ear is the cochlea, which converts the sound vibrations from the tympanic membrane and the bones of the middle ear to the auditory nerve, so that our brain can then process what we've heard. And the vestibular labyrinth and the semicircular canals are involved in giving us our balance or sense of balance and our sense of position in space, in terms of three-dimensional space, not outer space. And the eustachian tube there is a tube that connects the middle ear to the throat and helps to regulate the pressure within the middle ear. Colds can cause congestion of the eustachian tube, and that can lead to a temporary loss of hearing or reduction in hearing. So that's why colds can sometimes make us a bit deaf. And when your ears pop due to changes in altitude, the pop is caused by a sudden change in pressure within the eustachian tube, and correcting the pressure between the middle ear and your throat. And that's why you hear a pop when you go up high or come from a high altitude to a low altitude. So there's a number of common ear problems that you'll be needing to be able to diagnose or identify in the community pharmacy. So foreign bodies, so things like crayons, batteries, particularly the small watch type battery, even things like earphone buds. These are things that can get stuck in the ear and cause problems. It mainly happens in children, but with things like earphone buds, obviously that could happen to somebody of any age, really. And colleagues in pharmacy have had the experience of a child coming in with something in their ear, and when they inspected it, it was an earbud. The rubber part of an earbud was stuck in the ear. So that kind of thing, you'd need to refer the patient to emergency department to have it removed, because a hospital is somewhere where they'd be able to make sure it's removed safely without causing further damage and provide any further treatment that might be necessary. If you are going to try and remove something from somebody's ear, although it's probably not recommended in the pharmacy setting, but for a child, you should pull the lobe down, and that will help make it easier to get the item out. And in an adult, you pull the pinner up, so kind of hold the ear at the top and pull upwards, and that will make it easier to remove something. Symptoms of a foreign body will be similar to earwax impaction, and there may be pain, and if the foreign body's been there for a long time, there could even be a discharge if some kind of infection has been caused. Also, we'll go on to look at things like earwax problems, otitis media and otitis externa. Glue ear is something that would tend to be diagnosed by a doctor, so we're not really going to look at that too much in this lecture. However, glue ear is caused by a build-up of fluid in the middle ear, causing pressure, loss of hearing, that kind of thing. And if it is persistent, then a patient may need to have a tube placed in their tympanic membrane or their eardrum, which allows the fluid to drain out of the middle ear. This usually is a problem in children and not in older people. So we've got these possible issues, and we need to be able to make a differential diagnosis. So in otitis media, which we'll come on to, but some of the main symptoms commonly observed, especially in children, would be things like an intense earache, also headache. Patient may have a fever. They may have a feeling of fullness in the ear, which could be caused by a build-up of fluid within the middle ear. There could be leaking of fluid from the ear if there's pus and exudate. Patients may feel nauseous. That's often related to the infection interfering with the function of the vestibular apparatus, because that controls our balance, and if that gets affected by an infection, then you can become unsteady on your feet and get vertigo and feel sick. Somebody with otitis media may also have a temporary loss of hearing, and their voice may become a bit funny if they can't hear themselves speaking properly. They may get a sense of buzzing in the ears or tinnitus, and it could make somebody quite irritable. That's quite a range of symptoms that could make you quite irritable. Otitis externa, that's inflammation of the external ear, so from the ear canal out to the pinna. So that could be itching in the ear canal or of the pinna, maybe some earache, and that generally would be aggravated if you pull the earlobe, and that could be used as a diagnostic tool. There may be a release of fluids from the ear canal if there's exudate or pus forming. Hearing again could be diminished if there was a build-up of pus in the ear canal. There may be fever, and there may be inflammation of the skin around the ear canal and the ear. And we'll move on to the next slide. So first of all, we'll look at earwax and how to make a differential diagnosis of a problem with earwax. The wax is formed by cerumen, which is an oil produced by the ears, and it combines with epithelial cells in the ear canal and forms a waxy protective layer. It's water repellent and therefore acts as a protective layer of the skin of the ear canal. And the ear is usually self-cleaning, and the wax simply works its way along the ear canal and out into the external part of the ear. But if there's too much cerumen produced, it can cause an obstructive waxy plug to form and can affect hearing. So the usual questions about who is it for, what are the symptoms? In wax build-up, we'd have a gradual onset of deafness, possibly some discomfort. There could be a tickling in the ear. There could be itching, dizziness, and you may find that there's visible wax in the outer ear. Useful to know how long the patient's had it. Has it been gradual, or is it a recurrent problem? Have they tried any products for it yet? It's best to advise patients to not stick things in their ear to clean earwax, as that can lead to impaction of the wax and make the problem worse. And then thinking about any other medication or conditions, if somebody is taking drugs that could be ototoxic, that would be a bit of a red flag, and you may want to refer the patient to a doctor. So I mentioned not sticking things in your ear. There's a saying, often you'll hear ENT doctors say this, but you should never put anything smaller than your elbow in your ear. That's a bit of a red herring, because obviously most people are not able to get their elbow anywhere near into their ear. So you should advise patients to not use cotton buds or anything similar for cleaning the ear. There's a risk of serious damage to the eardrum and beyond. If they did happen to stick it through their eardrum, you can see in this diagram. It often leads to pushing the wax further down into the ear canal, which can make things worse with an impaction of earwax and make it more difficult to remove. In this slide, we're looking at otitis externa. So that's inflammation of the skin, of the pinna, or the external ear canal, or of course it could be both. This may be caused by fungus or bacteria most commonly. So as usual, we're looking at the questions for making a differential diagnosis. So we want to know who it's for. People who have frequent and prolonged exposure to water are more prone to problems with otitis externa. So this would include people that swim a lot, surfers, scuba divers, and other people that are in the water often. If the symptoms are associated with an upper respiratory tract infection, such as a cold, then in adults there's no need to refer unless the pain is severe and has not been improving after 48 hours. Generally, if it's associated with the cold, then as the cold improves, the ear problem will improve. Other symptoms could be dizziness, fever, itchiness, and there could be a release of fluid from the ear canal, particularly if there's pus being produced due to the infection. If an adult patient has had symptoms for more than 48 hours, then the patient should be referred. And with children, they will usually start complaining within 24 hours of these kinds of symptoms, and they should be referred immediately. So then moving on to, have they tried anything? So have they taken any pain relief to relieve the pain? Have they tried anything to relieve the symptoms? Is it a treatment failure? Are they on any ototoxic medicine? Do they have a history of excess earwax, perhaps? But basically with otitis externa, this requires a referral because it can become more serious, which I'll come on to on the next slide. Symptom relief for pain and pyrexia can be given with over-the-counter painkillers such as ibuprofen and paracetamol as appropriate for the individual patient. So I'll come on to the serious complications of otitis externa in a moment. First, we'll look at otitis media. So that's an infection of the middle ear. These infections cannot be treated in the community because it's in the middle ear kind of chamber, and nothing that we can supply over the counter can penetrate. But it's a common and painful infection, and it's common in quite young children, but it can affect older children and adults. It sometimes accompanies a common cold or flu or another type of respiratory infection, similar to otitis externa. And because the middle ear is connected to the upper respiratory tract by the eustachian tube. Problems are more common in the young because of the shape of the eustachian tube, which changes as patients get older, and it's less of a problem. So symptoms are similar, so pain, there may be discharge, nausea, feeling of fullness in the ear due to the increase of pressure of a build-up of pus in the middle ear. Similarly to otitis externa, in an adult, if the condition has not improved after 48 hours, you can refer, but usually it would be self-limiting and would improve within 48 hours. In children, it's an immediate referral. We're also asking about if patients have tried anything. You may want to offer pain relief if they haven't already used something. And it's similar questions. Are they taking ototoxic medication? Is there a history of excessive earwax? That kind of thing. So treatment options, as I mentioned before, in any age of patient, you would need to refer if you suspect otitis media. Patient may need antibiotics, although in children it's often self-limiting, and so they may not receive antibiotics, but the patient does need to be reviewed by a doctor. And as mentioned before, offer over-the-counter pain relief to treat pain and the pyrexia. So we need to think about what else we should ask, as well as the questions we've just covered. So is it just one or both ears that are affected? Does the patient have hearing loss? Do they have allergies to oils? Because for earwax, we may recommend an oil to treat to help loosen the wax and help it be removed. Do they have severe pain? Do they have a history of ear problems? So the treatment options for earwax. So products are usually intended to loosen the wax. Oils are a nice, simple and usually fairly cheap option. Olive oil is probably the most common that's sold for this issue in pharmacies, but you may also be able to offer almond oil or arachis oil. Remember, arachis oil is peanut oil, so people with peanut allergies should not use it. The oil should be a few drops instilled 3 to 4 times a day for up to 5 days. And it may be that this will help the wax clear itself. It will soften the wax and then the wax will be able to work its way out along the ear canal. Or it may be that patients then go on to have ear syringing or suctioning to remove the wax. Urea hydrogen peroxide, 5% ear drops, common brand name Otex. With these drops, you instill 5 drops once or twice a day for up to 4 days. And so that might be for up to 4 days before medical treatment, or up to 4 days and then allow the ears to then self-clean. The urea and hydrogen peroxide help break down the wax and soften it, and so then it can then leave the ear canal bit by bit. And docusate drops, known as Waxol, is similar in action. It will help break up the wax and soften it. It's used a bit differently though. You actually fill the ear canal for 1 or 2 nights prior to wax removal for it to soften, and then quite often the patient would go on for medical treatment of syringing or suctioning. If patients have actually got a current torn or perforated eardrum, they should not be applying any of these treatments to it. So treatment for otitis externa. Mild OE can be treated with over-the-counter treatments such as acetic acid. Acetic acid reduces the pH in the ear canal and therefore reduces microbial growth, so it can help treat the infection. It should be instilled at least 3 times a day or every 2 to 3 hours. Should only be used in children and adults over 12 years. But if it hasn't improved the situation after 48 hours, then the patient should be advised to go to their doctor. Painkillers for the pain and the fever, ibuprofen and paracetamol as appropriate. But quite often cases do need to be referred for antibiotics and possibly steroid ear drops. So they may be given steroid ear drops such as betamethasone drops, which are suitable for the ear, the eye and the nose, and flumetazone and pivalate and cleoquinol ear drops can be used for fungal infections. Complications of otitis externa, quite rare but potentially very serious. You can see in these images we've got redness and inflammation behind the ear. That area behind the ear, the bone behind the ear, is called the mastoid bone, and the condition you're looking at here is mastoiditis, so it's inflammation of the mastoid. And the image on the right, you can see it's a severely inflamed and infected external ear and ear canal. There's a lot of inflammation, there's pus exuding from it. And these can both be part of or signs of what's called malignant otitis, which is nothing to do with cancer, but it's an aggressive infection which, if untreated, can lead to meningitis and death. So if you were to have somebody present to you like this, you'd make an urgent referral, and I'd actually recommend that they go to the emergency department because they probably need admission for intravenous antibiotics. The reason it can lead to meningitis, if you think about where the ears are, very close to the brain, and the inner ear does connect to the brain, and so this severe infection basically can move into the brain, cause meningitis, and if untreated can lead to death. So if somebody has severe pain, inflammation around the ear, they should be referred immediately. So otitis media, the picture here is showing an otitis media with exudate or pus that's leaking from the ear. You can see the pinna looks normal apart from kind of covered in some gunk. So it's not otitis externa. The gunk is coming from the middle ear. So usually you may offer some symptomatic treatment for the pain, but we'll usually need referral to GP for patients that are indicated to have antibiotics. Antibiotics used usually amoxicillin, or in pen allergy it would be erythromycin. You can offer painkillers for the pain and the fever, and a non-pharmacological treatment could be a warm flannel or face cloth over the ear, can help relieve the pain. This video has some really useful information about how to apply ear drops properly. It's aimed at patients and parents, but it does have some useful hints and tips for pharmacists as well to help you counsel your patients properly. So take a look at this and then move on to the next slide. Now we'll move on to some other ear conditions. The first two are things that would not be treated by you in a community pharmacy, but it's useful to know what they are. So glue ear is quite a common childhood condition where the middle ear becomes filled with fluid, and the medical term for glue ear is otitis media with effusion, or OME. The main symptom is hearing loss, which may be in one or both ears. So particularly in children, they may struggle to keep up with conversations. They may become irritable because they're trying harder to hear and listen to people. And you may find that they're turning up the volume on the television. Glue ear will usually resolve by itself within about 3 months, but if the symptoms are lasting longer than that, or it's interfering with a child's language development, they should be seen by a doctor. They may need to have a tube placed into their eardrum to allow drainage of the fluid. Tinnitus is described as a ringing in the ears, but it can also be a roaring noise, clicking, hissing or buzzing. It may be soft or loud. It can be high-pitched or low-pitched, and it can be in one or both ears. It's obviously quite a subjective thing. Nobody else can know what it's like for an individual patient. So it's important to listen to them and be sympathetic and empathetic to them. Treatment depends on the cause. So if somebody coming in complaining of ringing or noises in their ears, you should always refer them. for medical examination. Vertigo, this is not a fear of heights. Vertigo is the giddy feeling you get when you have problems with your ears, or sometimes if you are unexpectedly kind of at a high place or something, you might get a feeling of vertigo. It's often described as a sensation of spinning, and it's often caused by a problem with the inner ear, as I mentioned earlier. So patients experiencing vertigo may feel dizzy, they may feel like they are spinning or the room is spinning. They may actually be tilting themselves because of their loss of balance. They may sway and be unbalanced. And vertigo is a symptom, not a diagnosis. It's caused by altered activity in the balance organs of the inner ear, and if it's not related to migraine, then patients suffering from vertigo should be referred to a doctor. Vertigo associated with migraine may, on its own, doesn't need referral, although migraine might. A perforated eardrum or tympanic membrane is a hole or rupture in the eardrum. Symptoms, it's often accompanied by a decrease in hearing. There may be some discharge and there may be pain. It will sometimes heal spontaneously, and other times it may need surgery to repair the hole. So if symptoms are persisting for a patient, they should be referred to a doctor. So referral, red flag symptoms for ear conditions. So I've already mentioned about malignant otitis, so severe pain, inflammation around the ear would be a clear referral symptom. Deafness, particularly if it's sudden. Discharge from the ears, a foreign body. Bleeding from the ear. Deafness has already been mentioned, but some kind of hearing loss. Treatment failure, so if recommended treatment's not worked after a particular period, depending on what the condition is, they should be referred. Abnormal lesions in or around the ear. And then suspected vertigo, tinnitus, otitis media, or perforated eardrum. These should all be referred. You may be able to offer over-the-counter pain relief to help with symptoms of pain and fever. There are other points to be considered, and some of these may constitute advice to patients as well. So I've already mentioned that cotton buds or similar should not be used to remove earwax from the ear. Cotton wool should not be left in the ear, as this will prevent the natural cleaning cycle of the ear and prevent debris from being able to get out of the ear. If otitis externa is a problem, then it's best to avoid irritants. So if patients have this kind of problem, then it can be useful to block off the ear canal when showering or bathing with an earplug or cotton wool soaked in soft white paraffin. Or patients can use a shower cap to cover their ears and keep them dry whilst they're showering. Patients should also make sure they gently clean their ears after swimming or being in water. Earplugs, earphones and hearing aids should be cleaned regularly to reduce the risk of dirt and debris building up and increasing the risk of infections. When thinking about how many drops to instill, there's a rule of thumb of 1, 2, 3. That's 1 drop into the eye, 2 drops or 2 to 3 drops into the nose, and 3 or more drops into the ears. If you think about it, this makes sense. The eye can only take 1 drop. Any more than that would just flush out. The nose is quite a big area, so 2 or 3 drops to make sure that the nasal mucosa is well covered. And then the ears, again, you've got quite a large area to cover in the ear canal, so 3 or more drops are needed to make sure that enough drug or product is delivered to where it's needed. So we've covered a lot in these two lectures. There's quite a lot to cover, quite significant differential diagnosis to be made. So do remember you do need to do some extra reading of the text on the reading list to consolidate this lecture, and make sure you become familiar with the products available. We've looked at quite a lot of symptoms, some causes and potential treatments for conjunctivitis, dry eyes, eyelid problems and some common ear conditions. You should be able to identify these problems more easily now, and how to rule out serious conditions. You should be able to recommend a suitable treatment with over-the-counter products, or when to refer when necessary. So these are the things that you need to be able to do moving forwards for both PAMs, OSCE assessments, and of course your career in pharmacy in the future.